Hi there, everyone. My name's Andy Stevenson. I am welcoming you all to this Royal College of Surgeons Sustainability webinar. This is the first session we're doing of 2024, and though it says that it's Royal College of Surgeons of England, this is being done in collaboration with the Royal College of Surgeons of Edinburgh also, and they have inputted significantly to this work. I will just wait to hear back that we've got everyone that we think is online, and then we will progress with the evening. We've got three talks. So we've got an introductory talk from myself, really framing sustainability, why it's important, why acting as healthcare professionals in a sustainable manner is important. And then there are two surgical registrars, Mary Claxon, who is a general surgical registrar working down in Taunton, Somerset with myself. I'm an orthopaedic surgeon. Mary has initiated the Rub Don't Scrub as part of the general surgical group here. And Alice Robinson, who is a plastics trainee and who has done her own QIP and service improvement project with regards to Rub Don't Scrub. And so there's slightly different ways of doing the QIP and instigating Rub Don't Scrub. So next slide, please. Yeah, so what I'm saying is factually based, my views and all of that. I'm the rep of the RCS England. I've given versions of this talk many times, so I hope you find it interesting. Next slide. So as I say, we are here. This is the webinar on Rub Don't Scrub, and this is one element of the Green Theatre Checklist, which is an intercollegiate checklist as to how to conduct your surgery more sustainably. And this, I love this image of an oak tree, because trees fundamentally are the only reason that we're here. They've been around for many hundreds of millions of years, and they're the reason we have soil. They're the reason that we have oxygen. And they are, for me, the epitome of the natural, sustainable system. And we can learn a lot through the way that they go through a variety of cycles. And I think refocusing on nature and how nature works will give us the ability to maintain ourselves as a prosperous species going forwards. Next slide, please. So the climate crisis can be quite bewildering, and there's a lot talked about it, and often people talk about and across purposes. And so it's really a triple planetary crisis. So the one that gets all the attention, or the most of the attention, is climate change. This is as a result of greenhouse gases. Greenhouse gases, principally carbon dioxide and other greenhouse gases such as methane, nitrous dioxide, the halothane anesthetic agents, and some others, cause the Earth to heat up. And is measured, the unit of measurement is CO2e. That E stands for equivalence. The greenhouse gas effect is causing our world to get hotter, and it's causing climate instability. That's the first element of the planetary crisis. The second one is ecocide, essentially. It's the destruction of habitat. Mankind has always impacted on its environment and on the natural environment, but we are really doing it in an unprecedented and industrial way. And so we need to take that into account when we're thinking about how to progress sustainably. And thirdly, the third part of this is pollution. You can see and smell pollution in the air, on the land, and in the sea. Plastic is everywhere, from the top of Mount Everest to the Marianas Trench. It's in newborn babies. We eat a credit card of plastic every week. And it's the weird way the world is now, that we kind of accept all of these three things as the modern way of things, and it doesn't have to be like this. Next slide, please. Now, these are two figures that the one on the left, as you're looking at it, Greta Thunberg, is a divisive figure. The one on the right is the grandfather of the nation and the conscience of the nation. They hold exactly the same message. So beware people that attack the messenger. It's called messenger shaming, and you should be aware of it if you are going to be an advocate for sustainability. you will either overtly or covertly lay yourself open to messenger shaming. So just beware. They say exactly the same thing. They are allies, and yet they're treated very, very differently because of how people perceive them. Next slide, please. If you want to get to know things, the BBC have done loads of good programs on it. I'm going to show you another one. Extinction, the Facts, and Climate Change, the Facts are two hour-long documentaries done by Sir David Attenborough, really outlining exactly what's going on with regards to those two elements of the planetary crisis. Next slide, please. And this is kind of where we are now. So this is a graph of last year. So this is from the Copernicus Institute, which is the European climate science lab, and it's based in Italy. And as you can see, last year, 2023, hottest year ever recorded, and by a magnitude that really upset lots of climate scientists because that is outside of their normal models. Next slide, please. And you can see the Arctic sea ice as well is in rapid decline. But again, I was challenged by someone just recently saying, oh no, the Arctic makes loads of ice every year. It does make loads of ice every year. That's the seasonal change. But overall, the duration of ice and the thickness is decreasing quite substantially. Next slide, please. And this is why we're here with regards to the climate change. Modern humans came in at 300,000 years BC. If you look at the x-axis, that big red arrow is just a little past 300,000 BC. The origin of the x-axis is 800,000 years ago. This is ice core data, and you can see that we haven't been over 300 parts per million CO2 until we hit 1950, and we've racked it up since then. We are now up to nearly 420. Next slide, please. And the reason for it is fossil fuels. Okay, fossil fuels are responsible for the vast majority of that CO2. A little bit's to do with other burning, but it's largely fossil fuels. So let's not beat around the bush. Fossil fuels are what are causing climate change, and they're also responsible for practically all the plastic pollution as well. Okay, it's all from fossil fuels. Next slide, please. If you want to get some detailed information on this is a TED Talk hosted by Al Gore, and this is 25 minutes long, really tells you exactly the extent to which the fossil fuel industry are going to try and slow this down. Next slide, please. And this is another BBC, this is a sort of triple header of big oil versus the world. Again, it's a pretty sobering watch, these three. As you can see in the bottom, the 3 Ds. So there's climate denial, there's climate doubt, and now climate delay. And we're still seeing denial, doubt, and delay playing out. The amount of money going into trying to keep things as they are, i.e. very profitable for fossil fuels, is extraordinary. Next slide, please. And ecocide, the destruction of nature, is largely down to us clearing forest for cattle. And if it's not for cattle to graze directly, it's for cattle fodder. It's for the monocrops that are, particularly soy, that are used to feed cattle, both in the home countries, but more largely for support for exports to other beef production and other meat production. Next slide, please. So I mentioned air pollution as part of the triple planetary crisis. Air pollution now is the #1 exogenous killer in the world. It overtook smoking 3 or 4 years ago. Most of this is fossil fuel related, though a proportion of that is due to burning indoor solid fuels in poor ventilation in resource poor countries. Again, it highlights the need for moving away from that sort of heat and energy production. Next slide, please. And if you want to have a look at it, this is the 6th iteration of the IPCC report. Over 20,000 scientists have put their names to this. It's the biggest scientific collaboration ever, and it encapsulates everything that I've said just previously. Next slide, please. And again, I always like to think of this man. He himself, when you watch those documentaries that I've mentioned earlier, really kind of puts an emotional edge on all of this, because he's seen firsthand, over the last 60 years, what we have done to the planet. And if you'll not listen to me, listen to him. And if other people won't listen to you, then ask them to listen to him, because he's a very powerful messenger. Next slide, please. So this is why us as doctors and healthcare professionals really need to get involved with this. Climate change, air pollution, habitat loss is going to play out with regards to health outcomes, and that's why we're here. We're not only good advocates for stopping non-sustainable ways of living, but we are the ones that are going to have to help people with the problems that it causes. Next slide, please. So, and this is where the Royal College of Surgeons of England and of Edinburgh and of Glasgow came up with this. This is a wonderful document from which the Rub Don't Scrub has come. Next slide, please. So this is searchable on the internet, on the RCS Ing and Edinburgh homepages, and this is a graphic from it. If you're not aware of the hierarchy with regards to sustainability, it's reduce, reuse, recycle, rethink, and then research. So reduce, if you don't have to do something, don't do it. That's the most effective way of cutting resource use and energy. If you can't not do it, then do it in a reusable way using reusable materials. If you can't reuse the materials, recycle them. And if you can't recycle them, you've got to rethink and research what you do. Next slide, please. So this is what the Green Theatre Checklist looks like. Next slide, please. And we're going to be looking at the preparation for surgery number 8, which is the Rub Don't Scrub. So next slide, please. So just to highlight that. So Rub Don't Scrub, I'm going to hand you over very shortly to, firstly to Mary to talk you through this, but essentially Rub Don't Scrub is the way in which the WHO, NICE and all the Royal Colleges advocate that you scrub up. So after the first scrub of the day, so when you have visibly clean hands, you do not need to use subsequent water-based scrubs. Alcohol-based hand rub is the way to go. Next slide, please. This is a poster from NHS Scotland that was shared with me by Vivian Goff, and just goes to show the sort of thing that could be put above a sink, just to nudge people to rub, don't scrub. And as I say, Alice, or first Mary, then Alice, are going to tell us about their QI projects that have instituted this and how far along the journey they have gone. And I'll hand you over to them. So next up, it's Mary. Thanks so much.
Hi everyone, I'm Mary. I'm actually a surgical SHO from Musgrove Park Hospital down in Taunton, and I've just been asked today to talk about our Green Theatre team and the work we've been doing. So I'm part of a multi-specialty group of surgical juniors, all collaborating to improve sustainability across our theatres, trying to exact effective change in practice. So Mr. Stevenson's already run you through the Green Theatre checklist, and our hospital has already made really good strides within reducing CO2 emissions in the anaesthetic aspect of this list, so the top part. So as a group, we decided to focus first on Rub Don't Scrub, which, like you've seen, is a part of the second aspect of the checklist, so preparation for surgery. This was a good option for us to make quick but effective change, as our hospital was already set up with the alcohol-based hand rub dispensers in all of its theatres, and a good proportion of our staff weren't using it yet. So I'll just briefly introduce the concept for anyone that's not sure. So next slide, please. So Rub Don't Scrub is a Royal College, NICE and WHO-backed evidence-based initiative aiming to reduce our water consumption and heat energy within theatres. Next slide, please. Next slide, please. So this is from the Royal College website, what's on the screen, but the advice is to use a traditional water-based scrub for the first scrub of the day, or if your hands are visibly soiled. For all other cases of the day, you can use an alcohol-based hand rub. And the current evidence supports this, finding that the alcohol-based hand rubs are at least as effective as traditional water-based scrubs. And if you wanted to review this evidence for yourself, it's at the bottom of the Green Theatre checklist or as part of the recent Royal College Green Report. So what are the benefits? Next slide, please. So current evidence shows that the use of alcohol-based hand rubs is at least as effective as using the water-based scrub. And remember that the water that we use isn't actually sterile. It saves on water, with the average scrub using up to 20 litres, which is a huge amount of water. It saves on heat energy, not having to heat the water. And since the average operation generates as much CO2 as driving up to 450 miles in the average petrol car, reductions here are going to make a big difference. So our hand of alcohol rub certainly contains a moisturiser, and the evidence suggests this lowers rates of skin irritation and dryness. It reduces the time taken to scrub down to just 90 seconds, and it saves the trust money. So there are many benefits to using this approach, not just for, and I say just for, improving sustainability. The big one here is saving water. Since we use up to 20 litres per scrub, with our hands only under the stream for about 5 litres of this, I think we can all agree that there's significant room for improvement without compromising our sterility. As we've grown fond of saying in our departments, you wouldn't keep the water running whilst you're brushing your teeth, at least hopefully you wouldn't. So why are we still doing it within theatres when there's a good alternative option with all of these benefits? Next slide, please. So what we've done locally, so we started with a snapshot questionnaire to gauge the current practice, awareness and opinions around the techniques used for hand sterilisation. And this was across all of the theatres in the hospital, across all specialties, and staff of all grades who scrub were encouraged to fill it out during just one day of data collection. And we were thrilled to get 94 responses, with the majority coming from scrub nurses, surgical consultants and surgical registrars, so the people doing this day in, day out. Next slide, please. Sorry for the slightly busy slide here, but this is just a few highlights from the data that we collected. So firstly, the pie chart on the left, as you see it, 68% of people hadn't heard of the Green Theatre checklist at all. 18% of people had heard of it, but didn't really know what it involved. For the central pie chart, which is sort of looking at the current practice within our hospital, 42%, so the blue segment, of people were still using a traditional water-based scrub for every case of the day. Happily 39%, so the green segment, were already following the Royal College advice, and this included 9 out of the 14 consultant surgeons that responded. Interestingly, 3%, so the red segment, answered that they just use whichever method the consultant surgeon's using, which just shows the importance of sort of top-down learning and change, setting positive and evidence-based examples for your colleagues. Then finally, the pie chart on the right, so 38% of people, the blue segment, thought that using the alcohol-based rub would be less effective than a water-based scrub, which highlights the opportunity here to instigate change by education. 59%, the orange and grey segments, thought that the alcohol rub would be as or more effective than water-based scrubs, which is what we found in the literature. Interestingly, those numbers don't match up with the actual practice, in that 59% think it's going to be as or more effective, but only 42%, which is the green and orange segments of the middle pie chart, are actually consistently using the alcohol rub. So there must be other factors in play as well, which leads me on nicely to the qualitative data. Next slide, please. So at the end of our questionnaire, we asked people whether they'd be happy to use the rub, don't scrub method, having just explained it. And 18 out of 94 responded no. So thematic analysis of the reasons given provided those that are displayed on the screen. These points have been covered individually during our subsequent educational interventions, and the majority stem from a lack of understanding, education, or awareness of the current evidence. Taking them point by point, we've already discussed the effectiveness of the alcohol-based hand rubs. We were already planning widespread local educational interventions. And then in regard to skin irritation, we've explained that our brand of alcohol-based hand rub actually contains a moisturiser, and that often people find it gentler to their skin. We highlighted that it's not the same as alcohol-based hand gels that people struggled with through COVID, as this was a common misconception. Medical legal defensibility was an interesting concern raised, and in response to this, we've emphasised the evidence base and the backing from professional bodies such as the Royal College, the World Health Organization, and NICE. The more difficult aspect is the cultural norm, habit, and not wanting to use an alcohol-based hand rub if the consultant surgeon is scrubbing. And these are more behavioural based, and often there's no quick fix. We hope for and are beginning to see a shift in the cultural norm, with more people discussing and using the rub, don't scrub technique, which will hopefully help change these behaviours for everyone over time. Next slide, please. So what have we done? We've deployed educational posters like the one on the screen above every scrubbing sink in the hospital, with QR codes to the evidence base, to Royal College advice in the checklist, and also to our brand of alcohol rub for kind of instructions on how to use it. And you may recognise those bullet points from earlier on. Next slide, please. We've also attended the theatre audit meetings for almost all of the specialties now, and presented our data and provided some education on this technique, along with the current evidence base. This was really well received, which we were really grateful for, and it sparked a lot of really valuable discussion around what else we can be doing to improve our sustainability within theatres. Our hospital is currently in the process of building new theatres, and we've approached the trust regarding pedal or sensor-driven taps and are just waiting a response. If we know that we're wasting 50 litres every time we scrub because the tap continues to run, even this intervention on its own is going to make a huge impact. The project's still ongoing, and there are various steps that we're still undertaking, and that includes persistent mentions at theatre team briefings, bringing in the alcohol-based hand rub reps, educating our foundation doctors and medical students to preemptively improve future practice. We're also in the process of producing some TikTok-style educational videos for dissemination across the trust and maybe beyond, to continue to raise awareness, keep people talking, educate, and hopefully instigate change. We're then going to be re-auditing in due course. Next slide, please. And then to just touch upon our future aims, we're hoping to produce a replicable package with all of our resources to provide to other interested hospitals or trusts, which actually I think Alice may already be doing separately. We plan to introduce Green Theme of the Week, where we highlight more sustainable practice, likely on rotation, to keep the repetition, to invoke lasting change. For example, things like not using gloves to transfer patients, not using Inco pads to wrap arms, and so on. And then we'll look to address other aspects of the Green Theatre checklist, such as theatre kit rationalisation, which I suspect will be our next project. Next slide. Thanks for listening. I hope that by the end of this talk, we convince you to use the alcohol hand rub rather than the scrubbing technique if you aren't already doing so. Yeah, thanks again.
Brilliant, Mary. Thank you very much. That's a really, really great talk and a good example of QIP in action, and the questionnaires at the beginning were really interesting to see the barriers to change. Alice is now going to tell us about her QIP with regards to rub, don't scrub. So Alice, please take it away. Unmute.
It would help if I unmuted myself, wouldn't it? Good evening, everyone. My name's Alice, and I'm going to talk you through, I suppose, quite a similar project that I did at Queen Victoria Hospital. But hopefully, I'm going to just explain it in a way that will encourage some of you or inspire some of you to do this yourselves. And to do that, I just need to kind of explain a bit of a basis behind how to go about doing a green project. So we've spoken already a lot about the Green Theatre checklist, and the reason why it's so useful is because whenever you're doing an audit or a quality improvement project, you need the standard or the guideline to base it on. And now you've got this enormous list of different things that you can delve into. And some of them are more difficult than others. Some of them are going to require quite big institutional changes in order to implement. But others are easy, quick wins, like rub, don't scrub. And as a trainee, you always want to, you tend to be the ones doing all these quality improvement projects and audits, and it's just really important that you make sure you pick something that you're going to be able to achieve, which is why Rub Don't Scrub is quite a good place to start if you're just at the beginning of your journey into green quality improvement. So just make sure that whatever project you embark upon, whether it's to do with hand washing or anything else on the checklist, just make sure it's something that you can achieve, and if not, then at least hand over to someone else if you do move on from wherever you're working. So I just wanted to mention sustainable quality improvement. You might have heard of it before, but if you haven't, I would really encourage you having a look at the SUSQI website. Effectively, the Centre for Sustainable Healthcare, which again, they have their own website as well, have created this kind of equation, as you can see on the screen, which describes like quite a nice methodology for carrying out quality improvement projects. So essentially, you want to improve sustainable value by improving or at least maintaining outcomes for patients and populations, but minimizing the environmental, social, and financial impacts of any intervention you make. And that's the triple bottom line, which you'll hear me speak about later. And I just think it's a really nice model because it's straightforward. It doesn't get too wordy, and it's a really good way of approaching any quality improvement project. So if you haven't already looked at these resources, susqi.org is the website. They've got great examples, loads of good sort of methodology resources that you can use. And then the Centre for Sustainable Healthcare have their own website as well, which is in the bottom left. And they have a whole kind of project-based database, essentially. So you can have a look at what other departments have done. So things like Gloves Off, Rub Don't Scrub, all the way up to much more involved projects, and it's all on their website. So I'd highly recommend you have a look if this is something that interests you. So the background we've already heard about. Anyone that that's dialed in, we've got a nice mix of different people, but there are some kind of more junior team members. So I'll just explain that generally speaking, people either use the pink chlorhexidine wash or a betadine-based wash. And these are both effectively soaps that you need water for. And that's how most people tend to scrub up for theatre. And this can use a huge amount of water because the sinks have different flow rates, and people do have a tendency of leaving the tap running while they wash their hands. And it has been quoted up to 29 litres, depending on what taps you're using and how long you're leaving them on for. And that's per person per case. So it's a huge amount. And we've heard about the issues regarding sort of carbon dioxide and habitat destruction, climate change. But we also just need to think about water itself as a resource. We use it, and I don't think we always think about the bigger consequences, that it is actually a finite resource. And there are lots of people who live in water stress situations. And with our current patterns, this could increase, and actually about 2/3 of the world's population could be living in water stress situations by 2025. And as mentioned, there is a carbon and cost impact of heated water as well. And water scarcity is a huge problem, as you can imagine. It leads to poor sanitation, poor health outcomes, and waterborne diseases like cholera, typhoid. And often with these issues that come about from climate change and environmental issues, it's not places like the UK that get impacted first. It's people that are already in quite stressed situations, and the impacts that we have in this country are far-reaching. Wetlands are disappearing, and as a result, ecosystems and natural resource will suffer, including agriculture. And as healthcare professionals, we need to try and minimise the environmental impact of what we do to promote health and welfare, not just here in the UK, but globally. So we've already spoken about the alternative, and that's alcohol-based hand rub. And NICE guidelines have, and as you can see, the World Health Organization as well, have endorsed this as a very reasonable way of decontaminating your hands for theatre for a long time now. But it seems that all over the country, people are using it in very different ways. And I think generally speaking, it's not that well known and people aren't using it so often. As we've mentioned, it has the same, if not better, antiseptic capabilities than water-based scrubs. And it can be better tolerated by users as well. I certainly find it's much better for my skin. And so getting started, and how I got started, is you need to see what's happening where you're working. We've spoken about different types of sinks. You can have pedal operated and sensor operated taps, and also so taps, or you can have sort of faucet taps like there were in my hospital. And it's not reasonable for you to go to your theatre managers and ask for all the sinks to be replaced. It's not going to be a quick process, and think of the cost involved in that as well. But something that you can do that I've had mentioned to me before, if you've got sensor operated taps, sometimes they run for just far too long than what's necessary. So there are ways of reprogramming how long the taps run for. And so that's actually quite a good way of saving water as well. Other little things on the side just to think about is people often use nail picks and scrubbing brushes, sometimes for every case, which again isn't really necessary. And these are single-use sterilized plastic pieces of equipment that will go in the bin. So I think considering when you need to use those is also quite an important part of it. So as with most hospitals, my sinks had taps. So to perform a baseline audit, I looked at 44 cases, which included 141 members of staff, and not one single person used alcohol-based hand rub, and everyone turned the tap on and left that tap running. And I actually measured how much water that was at our hospital. So I basically bought a universal silicone plug. I put it in the bottom of all the sinks. I allowed everyone to scrub up, and then I measured the volume of water that was used over that everyone scrubbing, and then made an average, and it worked out at about 11.6 litres per scrub, so a bit less than what's previously been quoted, and that's probably to do with flow rates on the sinks. And so using some data from the Environment Agency, it might be around 98 grams of CO2 equivalents just in the heated water alone. So that's not taking into account the carbon footprint associated with treating the water and processing wastewater at the end. Which means that a year of scrubbing at the hospital I was working at would work out as about the same carbon dioxide as driving halfway around the Earth. So taking all this information, I again made some posters and put them above all the sinks. And something I also tried to push was the concept of just turning the tap off while scrubbing. So I measured the water used in that, and it was still about 2.5 litres per scrub if the tap was turned off. And so, if people really don't like hand rub, that is also a very, very good option. In terms of raising awareness, I presented the findings locally in the plastics department. We actually, we also have a sort of green theatre team. I don't think it's quite as comprehensive as Mary's, but there's a few of us in the department that were interested, and we decided to launch a Green Theatre Week. So we actually modified the Green Theatre checklist. We picked out things that we thought were achievable day to day on a regular theatre list. And within that, we integrated another hand washing audit. And that helped spread the word. Lots of posters, and obviously just telling people to try turning the tap off, even if they didn't want to use alcohol-based hand rub. And re-auditing this, so we got data from 23 lists with 236 scrubbing episodes. And it was quite a nice thing to look at, because obviously you go from a baseline of absolutely everyone using water and not turning the tap off. So any slight change was going to be a good one. But as you can see, about 50% still stuck with that traditional method. But we managed to convince around 30% to turn the tap off while scrubbing, and just over 20% started using hand gel, which in just 1 week over these lists would have saved 1,230 litres of water, which is pretty good actually, just for a week, which works out about 10 kilos of CO2 equivalents, and a very modest financial saving, but every little helps. So coming back to that equation at the beginning, just to show how this kind of fits into that methodology, in terms of outcomes for patients and populations, we know that it's at least as effective as normal soap and water, perhaps even better, which would obviously improve outcomes for patients. It saves time, but I think overall the main benefits come from underneath. So obviously the environmental aspect, the carbon dioxide, the conservation of water, people tolerating the hand rub better, and just general satisfaction that you're doing even just a small bit to help your environmental impact at work. And in terms of financial impact, this is the reference at the bottom is actually quite a good paper to look at, because they've actually published their own essentially quality improvement project in the same area. And while chlorhexidine and iodine per scrub is really not that different, once you add the water on, alcohol-based hand rub is technically the cheapest. So, but it's really very equivocal, hence the only £7 saving. Nevertheless, at least it's not horrendously more expensive, so people can't complain about that. So I hope that's kind of given you a bit of an overview, maybe has inspired you to try this in your own hospitals. In terms of top tips, I think it's really good that everyone's attending the webinar tonight, because that's how you sort of learn about what other people have done and start getting inspired to implement it. I think find your trust green plan, and particularly if you're a rotational member of staff like I am, you can look ahead. So these things are usually publicly available. Every hospital now has to have, or every trust has to have, a green plan, and you can look them up, and you can often find people that are already doing things, so you can get some contact details. And so when you're about to rotate into a new hospital, you can just fit straight into what they're doing and get going. Join your local green team if you have one, and if not, think about starting one. Keep up to date with the Green Theatre checklist. There should be a second version coming out at some point this year, and it's updated all the time. It's a really good body of evidence, and it just gives you something to base your audits and quality improvement projects around. The Green Surgery Report, which is what's pictured on this slide, it was released at the end of last year. And again, just loads of really good recommendations, completely evidenced, and it just acts as more guidance for you. And staying in touch about the webinars. Always think about any project you do, just be smart about it and make sure it's something that you can feasibly achieve. And this project helped, essentially, we've been trying to recognizing that people want to get involved in these sorts of projects, but within time frames and not really knowing how to start, we've taken some aspects of the Green Theatre checklist and we've started making quality improvement recipes. So I've turned this project into a quality improvement recipe, which basically includes lots of background information. It includes a data collection sheet, so pro forma, where it'll calculate the carbon footprint and water savings and cost savings as well. So looking at the triple bottom line, and also PowerPoint slides. So once these sort of packages are together, they'll be available on the Royal College of Surgeons website for you to download and just start using locally. So you don't have to reinvent the wheel. You can literally just use what we've already done and crack on and do it. So keep an eye out. Hopefully they should be coming soon. And check out social media posts. So the Royal College of Surgeons posted a video today. It was my Instagram influencer debut. So if you are keen on social media, TikTok videos, and you're doing really good stuff at your own hospital or trust, the Royal College would want to know about it. And so do get in touch and send in anything that you have, because they may well turn you into a celebrity. So that's me. And I'd be very glad to welcome any questions a bit later, but I think we're going to watch the video first. I think it might be a bit jumpy depending on what your internet connection's like, but the video itself you can find on the Instagram page.
We all know we need to take care of the environment, conserve water, energy, and to practice in a more sustainable way. Did you know that operating theatres are the most resource-intensive area of the hospital? My name is Alice, and I'm a sustainability champion at the Royal College of Surgeons, and I'm calling on you to take part in Operation Green. How can you scrub up faster, greener, and cleaner? When I first arrive in theatre, I wash my hands to make sure they're visibly clean. I only use a nail brush and pick if I need to, and I turn the water off while I'm doing this. If you don't still leave the tap on while brushing your teeth, why would you while you're scrubbing up for 4 whole minutes? That's up to 30 litres of water in one of these sinks. This is the only water-based scrub needed of the day. If your hands are visibly clean, you can go straight to alcohol-based hand rub. After getting your gown and gloves out, use alcohol-based hand rub for approximately 2 minutes. It saves time, water detergent, money, and it's at least as effective, if not more so, than the traditional method. Find out what else you can do. Check the Green Theatre checklist today. Look after your and your patients.
Fantastic, Alice. Thank you very much for all that you did there. That's a really great project that you've told us all about, and really very specific and quite detailed with regards to the environmental impacts. And what a great video at the end. I mean, that's the way so many of us consume information now, isn't it? And it's so much easier to forward on something like that to push the message. And I know down in Somerset we're doing a similar thing. And if any of you are out there, if you want to have a look at that video again, or search the Royal College Instagram and social media pages to see if there's further content there. Now we've got almost 20 minutes left for discussion. And so before we kick off with the discussion, there is a poll. And I think, Alice, if you could launch that second question, please. So we probably should have asked this a bit earlier, but basically, can you say whether or not you currently use alcohol-based hand rub or not? What you currently do prior to having seen the talks that have been given today, and then after the questions, we're going to ask that poll. We're going to ask you that again. And just to recap on what Mary and Alice have done, they've taken slightly different approaches for QIP, both of them equally valid. And Alice really pointed out well, using the Green Theatre checklist as the gold standard against which to audit. And you can do it as a kind of an old-fashioned audit, audit against the gold standard and then institute a change and then re-audit, or you can do the more QIP one, the PDSA cycles, or you can do a hybrid version. It's not one size fits all, but we are going to be providing a recipe book that will be coming up on the resource page of the Royal College of Surgeons. So I would just like to say now that if anyone has any questions, please post them in the messages and we will answer them for you. But I'm going to kick the questions off. I'm going to ask both Alice and Mary. Alice first, this same question. The nature of surgical medical training is that you rotate out. Alice, how do you think you're going to be able to make this a sustainable change in the sense of a time-wise sustainability, in terms of making sure that this doesn't disappear when you disappear and everyone go back to the old ways of scrubbing up?
So when I did this project, it was in a very small hospital with basically absolutely nothing going on in terms of the green surgery, and finding the relevant people. It turns out that in terms of the anaesthetic side, which is often the way, the anaesthetists are much better at getting through the Green Theatre checklist and being a lot more conscious about green surgery. But there were a couple of anaesthetists there that had kind of, after COVID, hadn't really picked up on things. And I think just having someone push for something else has really got things going. So although I've rotated out of that hospital now, I hope I'll go back at some point and pick it up again. But actually, since leaving, I know that they've carried on with the green group, and they've now got reusable textiles. So I think sometimes you just need someone just to give a little nudge to get things going, and people will carry on doing things after you. But you do need kind of representation from everyone in theatres, otherwise it just gets really difficult. So you kind of want someone from management, you want some anaesthetists, you do want some consultants because they are permanent, but ultimately it's trainees that are good at just getting the audits done. So yeah, it's not easy, but if you can do a closed loop audit, get the posters out there, start the conversation, even if things drop off when you leave, at least you've made some progress and you've hopefully inspired the team to get going.
Brilliant. Thank you very much. Yeah, I think that's a really key point you've made there. Just to kind of summarise, is finding allies, isn't it? And this is something that I've really found in this hospital. You've got to find allies. and particularly permanent staff members. Mary, I've probably given it, you've probably had the answer there, but have you come up with any other strategies? So when you rotate out of your current placement, how you think you might be able to make this a permanent change, not just something that passes when you move on?
Oh yeah, I think it's a really important question. I think for me, it's a lot easier because I obviously have people like yourself and other consultant colleagues who are involved with the Green Theatre side of things. I think it's making sure that you kind of have people, you kind of highlight it as something that other people can get involved in and kind of help with that transition period. Certainly, I know that where I am, the SHOs and registrars are on a different rotation pattern. So if we could get some registrars involved, then they can kind of keep it going and introduce the next group of SHOs. And then the same with the SHOs when the registrars change over, so that there's a constant flow.
Brilliant, thank you. I'm just having a quick look. Phoebe or Antonia, do we have any other questions? Or I'm going to ask a few other questions. We've got some system changes, obviously, support pillar taps. Is the RCS trying to address this at a national level? It's the RCS and the intercollegiate group that is trying to promote sustainable care does have a national focus. And I suppose the analogy that we're trying to, hang on, I'll go back one bit from that. So yes, trying to change things at a national level, but already in the NHS, there's the NHS Net Zero document. So we're already committed to carbon neutrality in the NHS overall, scope 1, 2 and 3 emissions by 2045. But this is, we're on a journey, and we've only had the Green Theatre checklist out for 18 months now, and we're going to have a slightly more usable version. So absolutely, we will try and push this nationally. And it's culture changes takes a bit of time, and specifically if you want it to be embedded going forwards. I'd just like to, I hope that answers your question, Manu. There's another question here. Has anyone found an easy way of recycling, reusing the drapes that aren't needed but come in the sets anyway? Alice or Mary, do you have any answers for that before I just keep talking? And I know that people take them away. The single-use drapes do take them away for home decorating. I know they don't get completely thrown away, and they can also be used for lining of shelves in hospitals, just to keep things a bit easier to clean. But Alice or Mary, do you have?
Unfortunately, I mean the materials in these they're not recyclable. You can be creative in your own way, and a lot of them are fluid resistant. So instead of getting a new Inco every time, if you have a stack of them that you haven't used and kept to one side, I suppose you could use them in that sense. But really, they are pretty terrible things. And going back to reusable textiles is something we should all hope for.
I think it's a really good point. And I think the other thing that we've certainly talked about locally is with using the rub, don't scrub technique in your gown kit, there's often the drying towels, and they're certainly something that could be used for other things within theatres as well. So making sure that you kind of have a pot or a tub or something to put those in, so that they're not just going in the bin as well.
So if we could, Antonia, could you rewind to the picture of the Green Theatre checklist on my talk, the full-sided one, and just to touch on that and on that reusable drapes. So one of the things that we're going to need to plan for, that some of you may or may not have clocked with regards to sustainability, is there's been huge disruption to supply chains recently. Obviously, COVID disrupted supply chains, so is the Ukrainian war, so is the conflict in Gaza with regards to the Red Sea traffic, and so is, so many other events, not just climate change. And so talking about single-use drapes is important in the sense that if we all switched over to reusable drapes and reusable gowns, not only is that better environmentally, but we also make ourselves more robust with regards to the shocks that will continue to come in modern life. I mean, these events are not going to become less frequent. I'd say we're on an accelerating path. So we haven't quite got those back, but certainly that mantra of reduce, reuse, recycle, rethink. So when it comes to the drapes, if you get them in your sets, talk to your scrub team and ask for them to be changed so you can take it out. So and there we are in the preparing for surgery. Switch to reusable textiles, including theatre hats. On that question, just while we're waiting for another question, Alice, where did you get your hat? Because in your video, you're wearing a reusable hat. Is there anywhere you could signpost people to that hat?
Well, I've got quite a few hats now. I think I bought some off one of the scrub nurses' mum because she was making them. But a good place is always Etsy. Etsy has lots of really good hats. They're not cheap, but they're really nice, and I take good care of them. So I think it's well worth it. It's kind of like a little fashion piece as well. When you have to wear the same thing as everyone else all day, having a different hat's quite a nice thing, really. So I'd recommend Etsy.
Brilliant, Mary. Have you got any movement on hats?
Yeah. So I mean, I also have bought some hats on Etsy. It's always a good site. But I think our hospital, our trust is very kindly getting all of the juniors hats, reusable hats with their name and their role on it, which is great strides. Really good to have support from them as well.
I think it's great as well because it's a communication thing, particularly if you're a trainee, then no one knows you, and actually communicating in theatre, when you have a who at the beginning and everyone says their name, you don't remember half of them unless you work with them regularly. So I think actually from a safety perspective and probably for patients, it's just better just to have your name visible on your hat. So that's great. I think that's something that I'd like to look into as well.
Great. And I'm just going to pick up on a question from Shajil Mahmood. Are single-use drapes superior than recyclable, reusable ones in maintaining a sterile OT environment? There is no evidence of this. Okay, so in the Green Surgery report, which is also available, and also in the compendium of evidence from the theatre checklist, there is no evidence that there is superiority of single-use over reusable, and it's something we just kind of drifted into. And so you shouldn't feel worried by that. I'm an arthroplasty surgeon, and we are absolutely paranoid with regards to infection prevention. I rub, don't scrub, and though at the moment I don't have a full hood, but when I have a full washable hood, I'll be wearing that, and I'm very happy to use reusable gowns. With regards to the drapes, we need to figure out how we're going to do that, because we've been doing single-use extremity drapes for a very long time. Let's just see reusable ones. So one of the things that has also been mentioned in the comments here, sorry, I'm trying to talk and read. Alice and Mary, if you want to pick up any of the comments, is tray rationalisation. And I know that Jasmine Winter-Beatty, who is one of the co-authors of the Green Theatre Checklist, she's not with us today, has recently published in the BMJ about tray rationalisation. And that's something that I'd really look at closely, all of you. We're doing a project here at Musgrove looking at rationalisation of our total hip trays. There's so much equipment that is not required on the trays. So that's a reduction, that's reduce, which is right at the top. Is there anything there, Alice, that you can, I can't read it.
A few people have mentioned just trying not to over drape, and in certain cases you don't need a full sterile gown. And I think that's a really, really great thing to do, because like some procedures are dirty. Sometimes you're literally going into someone's mouth, or bum abscesses, and in plastics there's lots of very, very minor skin procedures that actually in certain parts of the country would be done in a GP clinic room. So I think you can, like, coming back to how you go about greener surgery, reduce is always the best. So if you don't need a huge patient drape, and if you don't need a full sterile gown for what you're doing, just don't use it in the first place. And the concept of field sterility is definitely a growing one. Hand surgery is also quite a nice example of that. And there is some literature out there as well by someone called Lalonde, particularly in Canada, if you were interested in having a look at that. And in the second iteration of the Green Theatre Checklist, there will be a section on field sterility as well.
Great, thanks, Alice. I'm just going to pick up on a question from Manu Srivastava, who said the theatre staff ordered drapes and equipment. I tried to pursue this in my hospital about reusable drapes and told they're more expensive. Same with reusable equipment. So it'd be nice nationally if we could coordinate, have a standardised way where hospitals can get reusable equipment. So that's a really well put, and that kind of frames one of the problems. So in terms of changing from a linear economy, which is what a single-use economy is, which is basically you make stuff, use it, and throw it away, to a circular economy, whereas you make stuff, you use it, you clean it, reuse it, and then do it again. You need to have that workflow, as it were, set up. And so that will require a business case. It will require going and talking to all of the stakeholders involved in that, from procurement to laundry to transport, and all the people that are going to be part of that circular economy. Because essentially this is what we're trying to do, isn't it? We're trying to build a circular economy, not a linear one. In the long run, it's cheaper to use reusable. That's a full stop. That's easy. But in the short run, it's more difficult, specifically because of storage and space available for it, but also because of the fact that we don't have the laundry capacity to deal with it just presently. So that kind of encapsulates a real problem with regards to changing to sustainable workflows. It does take a fair bit of work. And that's one of the reasons that we started with the Rub Don't Scrub as the first webinar, is because this takes very, very little change. Most hospitals have ABHR, alcohol-based hand rub, available, and this is an evidence-based change. I've got one new message. While I'm reading that, thank you, Manu. That's very kind. I'd just like to put up. Can we put up Alice's final slide, please? And so I'm just going to make a big note of this. So this is the Green Surgery Report. So the compendium that goes with the Green Theatre Checklist, which is what we're taking the Rub Don't Scrub off today, has over 90 references in the back about sustainable practice and how to do sustainable surgery. It's all evidence-based. Most of it's very uncontroversial. And so I'll just take one of those things and just make one of those changes. Today we've done Rub Don't Scrub. This Green Surgery Report that came out over Christmas has got over 600 references in the back. It's headed up by Professor Mood Bhuta from Brighton and Chantal Rouzan from Surrey, who are the principal authors. And this has been, can't quite see it at the bottom, but it's been a publication funded by the UK Health Alliance Against Climate Change, which is an organisation with over 1 million representatives. You're probably a member of it without you knowing. And I would urge you to have a look at this. Specifically, do read the whole thing if you have time, but there are quick takeaway messages. Now, I'm conscious that we're coming up to the end of this. I'd like to thank you all for coming. Alice and Mary, are there any questions you'd like to ask each other or myself, or pose to the group? Oh, and I suppose while we're doing that, while you think of that, can we do the final poll? So Alice, if you could link the final poll, if you could fill out the final poll, that would be really good. And there on screen, you can see the QR code that links to the Royal College Sustainability and Surgery webpage. Please do go and have a look at that. That has got lots of good linkages. It's grown a lot recently, and that's going to be the place where we host the recipes for the Rub Don't Scrub. There is also on there my email, sustainabilitychair@rcseng.ac.uk. please feel free to send me any emails or queries that you may have, and I will try and help you in any way, or more often than not, it's about signposted. We've got one final question that maybe Antonia or Isabel could answer. Is the webinar recorded? Will this be available? So I don't know about that, but I think we'll certainly try and put a link to that. We might cut out the question and answer bit at the end, but we'll have a look. Let's see what that is. Will be put in Medal. Okay. Will it be put in Medal? We will find out about that. So I'm happy to keep talking for another 5 minutes or so if people have questions to ask, if you would like to do that. Otherwise, I thank you very much for coming along and taking the time out to listen to our talks. I'd like to say a massive thank you to Alice and Mary for coming and giving up their time and for presenting the work that they've done. And I think it's really fantastic to see how things can change and how things can change quite quickly. And for me, it's a very hopeful thing that that we're all gathered today talking about this. So, and I've just seen from Phoebe there that yes, indeed, the video will be available on Medal. So if there are any other questions, please feel free to post them and I'll answer them. And just thank you very much for Mary, Alice, Phoebe and Antonia in the back room for supporting today's event. We'll leave up the screen there if you want to take a picture of the QR code and take any of the contact details. Thanks so much.